Well, the first thing that we do is warm up. So that's what I'm going to do. And I'm going to show you how to use your body in this position a little bit more than you have been. As I notice a lot of you, when you start, are pretty static. Like it's a lot of arm. And lean back. Lean into your work and notice I'm not taking my hands off her. And I won't unless I'm talking with my hands and showing you something. I also do a little bit of range of motion with her shoulders as I push her shoulders down towards her feet a little. And you also notice that my shoulders are down. My shoulders are nice and relaxed. That feels nice. Kind of go back and forth a little bit. Bringing my hands up through. I can go into the clasped hand, overhand move that you know from Swedish. Slow that down. You got it. So this is also part of the assessment. When I slow down, I can really feel that Siobhan has some restriction on this side of her neck that isn't present on the other side. Because as I pull through, I feel the muscles on the left side of her neck are softer. When I pull through on this side, I'm feeling like it doesn't want me to. Of course, you can go down into the rhomboid area and pull up through. Some of you do that. Choose to when you're massaging. And we're going to say that we have done our Swedish. Okay, and we're moving on. So what I did, let me just show you here. As I came up through, one hand stays where it is, the other hand rotates. Okay. One of the things that I'm going to ask you not to do anymore is place your hand on their head. Okay. I know that's a holdover from Swedish. I'm going to ask you to stop. And the reason that I'm asking you to stop is because once you start doing deeper work, you tend to smash their heads into the table. I know because I've been the recipient of that many times. As students are focusing on using more force in one area, they accidentally use more force in another. So just let it go. Okay. Plus, you're going to need this hand to keep the hair up. Well, right now I'm keeping Siobhan's hair out of it. Yeah. And there will be times too when I'm using this hand to keep the head steady. So let's do that now. So let's go into our ironing. Okay. I'm using a soft fist. If I were to iron, you see how her head moves? I don't want that. So I'm just gonna keep my hand very gently back here. Keep the hair out of the way. And I can iron and her head doesn't move around. And again, I'm using my body, not my strength. Much easier that way. I've done a couple of ironings. I'm going to transition into like a flat knuckle here. And And one of the things that I want you to keep in mind if you try this is that I am posterior to the ear. So I'm on that big wad of muscle back here, those 9 layers. I'm also trying to keep my wrist as straight as possible. And then once I get to where the acromion and the clavicle meet, I don't go any further. We're not trying to go bone on bone here. I just turn it around and come back. How's that touch on? Is that pressure okay? Just checking in. Try that one more time. And I'm slowing down as I get to the bony landmark because I don't want to accidentally go over it. Okay. So we've warmed up this area a little bit. Now we need to focus on warming up the neck. So we have a lot of different options here. Since her neck is rotated, her muscles are in a lengthened position for the most part. So I don't want to put too much pressure on, and I certainly don't want to smash her neck into the table. That's not what we're about here. So we're going to be doing variations on circular friction. Okay. If we want to use a little more pressure, we may want to bolster the head on the opposite side so that we're not shoving her head into more rotation. So we'll just start with a few things here. I'm going to start with a flat thumb. So you're allowed to use your thumb here now. So this is just simply, it's like an effleurage with my thumb. You notice I'm not digging in, but I'm also not doing the hitchhiker thumb either. So if your thumb does this crazy backwards thing like mine does, you're going to have to be extra careful that you don't let it. Do a little circular friction. Again, we're going to stay posterior to the ear. Just doing some circular friction on, well, there's a couple of things here. But upper traps and levator, splenius cervicis and capitis. Levator's down here. And you notice that I'm going nice and slow and I'm very intentional with my circular friction. This isn't like just, rubbing to warm it up, because what's the point if I'm not also palpating? So I'm feeling into the muscle tissue. I still haven't really articulated layers yet, but I'm feeling where there's some restrictions in here. There's some adhesions, and you can see them as I move them. See that? Thunk. See all the thunking that's happening? Yeah. So my brain's going, doo, 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 doo. Okay, I definitely want to work on some of that. So little finger circular friction. You can always go back to the ironing. You can always go back to a flat hand. Now I'm going to start to get a little more specific because she is a little hyperemic. Technically, I would warm this up a little bit more. But for the interest of time, so what I'm going to do with her, because she's really tight in that area, I don't want her so lengthened like that. That's going to be uncomfortable. And I don't want to push on muscles that are so taut in that position. So instead, I'm going to take her to maybe here, and I'm going to keep my other hand as a bolster for her head. Okay. And that's a little bit better. Okay. So now what I'm going to do is I'm just going to start to work transverse to those fibers. So I know approximately where I want to be. And I am going to use my thumb, but I'm going to keep my thumb in a flexed position. Okay. So my hand is going to go under her neck like that. And I'm just going to start sort of like near the spinous processes. And I'm going to work across, oh yeah, work across the tissue, and you'll see some thunking as I go across the muscle tissue. Now, when I do this, I'm going to ask Siobhan, is there any place that feels more tender than the others? Like right in there. Okay. So not back here so much, but once I get to like right in here, that's pretty tender. Okay. Does that refer pain anywhere?
Not really.
Okay. Like it just stays kind of right where it is here.
And then here.
Okay. So what muscle do you think that I am on here that's doing this? Watch the pattern. Where is it going? Is it going anterior? Is it going posterior? Okay. So that's a good start. So it starts up here and it's going posterior. Can you see it all the way down to here? So what muscle starts up here and goes posterior this way? Levator scapula. Yeah. Yep. Good old levator scapula. So we're using our critical thinking skills to figure out what exactly we're on here. Well, we could be wrong, but we can make sure that we're right. How can we do that? The action. Yeah. So I'm going to put my fingers on this, what I think is levator scapula here. And then I'm going to place my hand on her shoulder. I'm going to ask her to push her shoulder into my hand. And it contracts. Okay, good. Then we know that's what we're on. Easy enough. All right. Now, to address levator, we can do a lot of different things, but since we're right here and we know some trigger point, we can find the most tender spot. We're going to say it's right there, okay? And right now, I can ask Siobhan to take a deep breath in. And as she exhales, I'm just adding a little more pressure. Notice I'm leaning in. Okay. How's that? Does that feel like a 7? Okay. We pretend we're at a 7. Okay, we're at a 7. And I'm going to ask her to take a couple deep breaths. And basically, I'm just waiting for softening. And I'm watching her breathing. Like actually literally watching that she is breathing. Okay, how does that feel? Remember, we come out slowly. And while that softened up levator a little bit, that opened up the deeper layers, and now there's more adhesions, which happens. Once you get the superficial layers to soften, you might find more. That's okay. All right, so we're going to move on just because time. All right, and we hit levator. That was pretty easy to find. So I'm going to go in here and I'm going to be a little more intentional, and I'm going to find scalenes. So the first thing that I want you to do is find SCM. And how do you do that? Yeah. So I'm going to ask her to bring her ear to the ceiling. There it is. Now, all of this is SCM. Do you see that? All of it. Okay, relax. So a lot of times we think, okay, well, I'm posterior to SCM here. That must be scalene. Lift your ear again. That's not scalene. That's the posterior head of SCM. Okay, so I need to be posterior to that. Okay, now put your head down. Thanks. So once we have our our finger position. Once we have our finger position here, I'm actually going to push straight in to the tissue and then slightly down, okay? And what I'm going to ask her to do is to take a quick, deep breath, like somebody just said, boo. Oh, really? Boo! There we go. That's better. Okay. She's like, ah, it's a lovely day. Yep, there we are. Okay. The little teeny round cylindrical muscles that are right underneath my fingertips here, those are scalenes. Are those tender?
A little bit, yeah.
They are on a lot of people. Okay. So you see that little roundness that my finger is on? Can you see that? I'm going over it. That's scalene, and that is all the room that you have for that. Okay. So for scalenes, you only have little teeny tiny rooms, so you're only going to do little teeny tiny things on it. Okay. Little teeny tiny circular frictions, little teeny tiny cross fiber frictions. You know, this is all fingertip here. Now we do have the external jugular vein, and we do have the carotid in here, but luckily her carotid wasn't near her scalenes. Sometimes it goes directly over the scalenes, so you just really need to be careful of what it is that you're feeling underneath your fingertips, okay? If you feel a pulse, you get off of it, but you don't have very far to go. We're talking like you just slide your finger a little posterior, okay? Now for SCM, this is one that I do not want to address when it's in its lengthened position because that puts way too much pressure on it. So for SCM, I'm going to turn her head to neutral or maybe even rotate her head into that side so that there's some slack in the muscle. So you see the difference here versus here. It's a lot more. Now, luckily, her SCMs aren't too bad. She's just more levator issues today, but I'm going to hold her head. So you see where I'm holding underneath her? She's still, her head is on the table, but I don't want her to go anywhere. I want to have control. So what I'm going to do with SCM is I'm going to use like a pincher grip. And I'm just going to grab it a little bit and wait for softening. And this is only if they need it. She actually doesn't. Her SCM feels great. It's nice and soft. You wouldn't do this to everybody. Only if you note that their SCM is rather tight. See, like I can pick up her SCM, so she's good. Does that feel okay? A little weird?
Yeah, a little weird.
For sure. It's new. But you're just using a pincher grip and you're holding and waiting for softening. Yes.
What the muscle that like doesn't necessarily fit to be potentially cause like tension building or
Well, maybe, but more than that, your time is limited. You know, if her SCM feels good and I don't need to work it, well, most certainly she needs the attention back here. So I want to save that time. I mean, I can go over it and just sort of warm it up and things like that, but I think it's more, it's the time that you have versus what you're going to do. Okay. So while we're in this territory, I notice, you know, a lot of you do this pincher grip here through supraspinatus, and it feels really nice. Well, let's level that up a little bit, okay? Most of what we do is pushing into the tissue. You know, we use pressure into the tissue. We don't tend to decompress the tissue a whole lot or separate the layers of fascia and the layers of the fibers of the muscle. So here's an area where we really can do that. So we're going to start with the same thing that you do, just using that clamshell or the Lego people grip, what Katie calls it, okay, to pull through. But once that's warmed up, we're going to slow that down and we're going to intentionally pull it towards us. And so we're just going to decompress that tissue. You might find that you get some release, like you start to feel those, there it was, the thump, thump, thumps as a muscle does a little twitch. Now you don't want to slide off of this. You just gently let go. Because if you slide off, it's just going to recoil and that feels really bad. Okay. So whatever hand you want, you can use both. You can switch hands. It doesn't really matter. But we're just going to take supraspinatus and we're going to lift and pull towards ourselves. Is that okay, Sean? Like having sort of the weight of the world lifted off your shoulders in a metaphorical sense. Just relax it there. And so we already got some softening. So I do the floppy test, which is highly scientific and very technical, you see. So you choose one side and you flop it. And you see the floppy, flop it. Okay. Oh, crap. Flop, 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 flop. Okay. It's not flopping too much. The other side. Yeah, she can feel the difference. She's like, oh, it flops. Yeah. See, flop, 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 flop. The floppy test. Okay. We note that we have softened this side by the highly scientific floppy test. Okay. Now you're also free to push in. You know, we do compress this area. This does feel really nice. And people do tend to have trigger points right in the belly there. But if you're going to do these trigger points, it's going to be a knuckle or a reinforced knuckle because we don't have the room to use any bigger tool. And we're definitely not using our thumb in here. That's really like a neck and small muscle only. Okay. So it would be it would be a knuckle. And remember, if you're going to do that, your joints have to be stacked. They have to be in a line. And you're using body weight, not strength. Okay. That feels pretty good too, doesn't it? Yeah. All right, so last but not least for this side, remember I said we were going to do a little bit of suboccipital work because that's involved in that upper cross posture. We can't, I mean, we can do one side at a time, but we're going to hit both sides because we're going sort of deep into the base of the occiput here. We can use our fingertips as we slow down. And that feels really good and people love it. Doesn't that look great? Like you want it done to you? Yeah. Or we can use the weight of their head to assist us. And this is something that I'm not sure if Katie showed you, but I think gets shown in connective tissue as well. You put your fingers at the base of the occiput here. You pop them into the air. And so the weight of their head has to fall down around your fingers. And it takes, depends on who it is, but you know, it can take a little bit of time. Take a big deep breath for me, Sean. See, there it goes. Breath work really helps. Once you feel that person sink down over top of your fingertips, then it's done. You just slowly come out. Okay, so just to reiterate, your fingertips are here. This is why you need short nails, folks. Fingertips are here. So right where the neck meets the skull. Okay. And then once, of course, you have done your deeper work in the neck, You use your deep tissue principles and you work backwards. So we work superficial to deep, then we work deep to superficial, broad to specific. Now we're going specific back to broad. You can do so many lovely things. Do a nice little range of motion. Either way, you always want to be moving your body. What do you do at the end? Classic touch. And thank you. Remember, they're allowing you to stick your fingers, your elbows, and things into their muscle tissue. You definitely want to thank them for that trust. Okay, folks.